Hello and welcome back to my channel. Cái channel là invite kan lo le chiwa topic karon than chu acne Hmaibawl damdoi lampang treatment lampang mar chu ta po chuan in part nia thena nga ya topic alian kan ti to kha voin chuan di Hmaibawl na salo Hmaibawl a hian category song ma category 1 to 4 oma chu a treatment kan pek na tlang pui na salo type ni treatment at noi chi lampang kan soi don ni. So as I've said, we will be talking about acne today, pimples again, but today we will concentrate only on the mild and moderate form of acne and the treatment part. In my earlier video I have already shown what are the causes of acne, the pathogenesis of acne and pimples. So today we will be talking about how do we go about treating them. Let's start reading from this book, the Dermatological Therapeutics, which I have shown earlier in my videos also. We will concentrate, as I've said, on this particular area. Mild involvement therapy. I'll start reading from here and I'll continue explaining on the way. Number 1, mild involvement, which we usually prescribe, bacteriostatics. Bacteriostatics are thought to improve acne by decreasing the formation of harmful byproducts, but not necessarily the actual number of the P. acnes bacteria. This is, I think, self-explanatory. Because P. acnes bacteria growth ka amtrinani pilosebaceous unit kanti. Takmane kanti lanta ka khan tahian. That P. acnes bacterial growth ka amtrinta kami population sangzel nairon siam tur zuti claim tur khanin bacteriostatics kan pe ti na ni me chu bacteriostatics ja chu bacteria ti claim tu bacteria amo bacteria ina thil produce tam tak ti claim tu khan bacteriostatics kan pe thina ni chu chung bacteriostatics to in thing e nang le. Number 1 bacteriostatic we commonly use is benzoyl peroxide. So this benzoyl peroxide are available in many forms. They are usually available as gels and creams, and they can be applied as they are usually given as face wash or bacteriostatic benzoyl peroxide production. Here, strength they usually the formulation is in the form of some 2.5% to 10%. Some of them are available as 5 to 10% concentrations also. But the side effect of this drug is that it can cause irritation. Maya kanin thapte thief leo te asiam de china ni chu benzoyl peroxide a common no to ka le tur tam tak company tam takin siam ming sang in benzoyl peroxide content and dan po kanin shil to ka. Number 2 is topical antibiotics here. In the topical antibiotics, most commonly we use clindamycin. However, erythromycin is also available. But in most of the chemist shops and most of the dermatological practice, we usually give clindamycin phosphate available in 1% concentration. Clindamycin hichu atlang puin kan cho common emema dor tam takale dur po oma tin himboka maya irritation siam tlem amaro chu tam doi reng reng ngei lo ombe thei fe kania clindamycin on ngei tami alo on khota te po hi kan tong fowa chuwan chuanin a safety wang khanin mi zong sun kan ngei chong lo din ani chu. Number 3 is salicylic acid. Now this salicylic acid is a beta hydroxy acid that penetrates into the sebaceous gland and has comedolatic and anti-inflammatory properties. It can be used adjunctive therapy and is found in this is important. It is found in cleansers, toners, masks and peels. Its side effects include erythema and scaling. This is very, very important because salicylic acid is very, very commonly present in chemist shops and in the over-the-counter drugs. They usually act by decreasing the acne formation. Comedolatic means whatever comedones, the blackheads or the whiteheads which are formed, they are supposed to be cleared by salicylic acid from outside. Also, anti-inflammatory property means whatever the bacteria has caused the inflammation, it is supposed to be decreased by salicylic acid. But people using a lot of salicylic acid, they have to be careful because it can cause a lot of dryness, redness and scaling. Salicylic acid is product tam taka oma cleanser te toner te mask te tin ke mani kan practice as chemical peel la po kan mang na sa ni chemical peel la he chuan in home base ani lo wang yan concentration hi 20 to 30% very kan long tlang puya in lamati ve chi ni lo he chu ke mani an doctor practice kan man thin percentage ka soi me ni chu side effect om the chu vuna tirowa vun ati phuli pokani chu bang chuan salicylic acid mang chuan in khami ka side effect om ti ka sha tang turani a tin heta a in tar lang lo ka soi du chu salicylic acid ring rang hi rai pora kan pe ngai lowa a chan chu rai pora tan recommend an ding lova I now pai chuan man lo tur. What I want to say about this is that this exfoliants means we are trying to cause exfoliation of the skin so that it will decrease the formation of acne and comedones. But however, this book says that, can you see the arrow? Most of these are source of additional injury to already inflamed skin and may be ineffective in removing deeply rooted comedones. So what it says here is that just simply keeping exfoliating the skin from outside usually does not necessarily remove acne which are deeply rooted. So it might cause additional injury to already injured skin in an acne person. Heta soi hi chu hei mai phi na po exfoliative kan te chi a pon lamatanga scrubs and siam te rubs and scrubs and siam ang si khanin I Hmaibawl pem sen na to sa khanin nataka pon lamatanga va rub and scrub pok ang chi kha va noi pok ang chi kha a him ber lo me thea a bikin arangeng kha alo thu chuan a hol pum ka thuk te wote ni chuan in effective chuang lo ti ni chu bun kha avati kliam ve thea chu bang chuan film khurangai ti na ni chu. Number 1 is benzoyl peroxide gel, which we already talked about the mode of action. Number 1 benzoyl peroxide gel is consoi to. Number 2 retinoids. Retinoids are very commonly available in the market and they are usually prescribed as first line therapy by dermatologists, and let's see how it acts. Retinoids kan ti chu anti-aging ate kan mang thina kan prescribe na se mema aranginga hian engting e thorve dan reng hi anen taila. It acts by keeping the skin layer thin. Skin layer at the thin tani, which means that the comedone formation is decreased by retinoids. What they do is that they decrease the stickiness of the cells around here. Hemi area kanin hemi plugging follicular plugging gantita hemi opening pore opening block 2 omchina kha cells omchina kha a in char khom tur kha retinoids kan hnoi chuan kha in char khom lawin siama hemi opening hi enge I sebum flow kan tia kha flow reng thei turin siama chuan heta lawin collect tur hol pum lo in siam tur te arnginga lo chang tur te kha helai opening om kha chuanin avoid chintani. Retinoids, most of them what they do is that they decrease the stickiness of the cells around this area so that there is free flow of sebum from the opening, and it avoids formation of comedones, whether if it's a small or large comedone, it avoids the formation here. Continuous flow of sebum out from this opening so that it avoids formation of comedones. Now what does it do? It causes thinning of this the upper layer of the skin. Retinoids always cause thinning of the upper layer of the skin. Kami athoda na chu hemi kan vun cha zonga ka atipan ta ni pon lama tanga alo nei bang khan tu ta tak chona poi mona chu side effect nei ta ni side effect a chuan I hemi vun layer ati pan chuan nisa te kha ando thelo bika nisa ne na in reacta sunburn te irritation kan ti a sen te a ro te a dry te a phul te om du thini ni. So it causes because of thinning of this layer of the skin, they are very easily irritated by outside physical agents like sunlight, harsh treatment, hot water, and it can lead to scaling, redness, burning sensation and irritation over the skin. So we should always remember that retinoids cause these side effects. Retinoid side effects what the anti-aging creams the point side effect and need to share to. Now what are the products which we get? We usually can give tretinoin group. We can give adapalene. Adapalene is a little less irritant, but mechanism of action is the same. Adapalene hi common me makan penasa atlang puin retinol group hi sunlight nisa nen in react he wangin zana kan pechina. We usually prescribe these retinols to be applied at night because it can react with sunlight. As we said, irritation is also a problem. And another very, very important thing is out here, all these drugs not given during pregnancy. taksa zuin Hebrew ta note zu ti chetur chuan a concentration chu atlem amaro chu reports pani pathum lek po alo om ve khan naw pai tan chon a himlo thauta a himlo dana ka a percentage sang viau lo ma se pek lo ka kan thlang jok thin ani. I will mention here very very important, all retinols, retinoids, these products are not prescribed during pregnancy because it can cause problems in the baby, in the fetus, so it is usually not prescribed. The amount which is absorbed in the skin to cause problems to your unborn child is very minimal and the risk is minimal. However, no doctor will put you at risk or put your pregnancy in danger. Okay, now we will talk about how do we apply retinols. Retinol no idan le skincare ti dan kan lo chiarang. What we usually prescribe is not exactly what is written from the book, but however I will read from this literature. In this point A says you apply sparingly every other night. In the beginning it's usually not applied every night because it can cause irritation, as I've mentioned. Practically it's on zan khat dana zan tin an noi sin phota I an tolerate lo chon in kan ti tlema thena chon zan khat dana kan noi tir phota chon an tolerate chon in kan ti tamzel ta. What it says here is that you have to avoid application over the eyes, lips and the neck. Long le mui le midvela noi lo dur tin chu. After 2 to 3 weeks, if excess irritation, erythema, dryness or scaling is noted, increase to every night. If no excess irritation, kahnikar thum zan khatana han noi kan emma problem am lo chuanin zan tin noi theya. For tretinoin, apply before bedtime on thoroughly dry skin. Tretinoin noi thina chuanin vunkha mutona vunro noi turani chu. Now B says use mild gentle soaps not more than twice daily. Ni khata soap face wash tetle mamal deule khan ni khata ve ni bak mai philo turani retinol man lai one and dryness ka kan avoid ve thong mai wangin. C, avoid excessive exposure to sun, use sunscreens. Nisa ompok lo turani sunscreen man nge turani bok. D, use water based cosmetics if necessary. Kan cosmetic kan makeup man kha water based tu ya tanga siam aqua based kan tian si ka mana thani chu. E, expect mild redness and peeling within a week, lasting 3 to 4 weeks and flare up in the acne during first 2 to 4 weeks. This is explained as a surfacing of lesions on the skin. This says that we have to expect acne flare in the first 2 to 4 weeks. In my ka aron bol abol are don moi ti lai aron bol tok tok chuan ka ni kar thum in noi tan tira aron bol tok tok chuan a normal ti sha turani a he hi I arngeng kha Hmaibawl ka chhunga tangin aron chuak chho tan ti na ni mai soi thiam dan chuan. F says clearing requires approximately 3 months. This is very very important. Don't expect your acne to clear in the next 1 or 2 weeks of applying creams. Expect your treatment to last for at least 2 to 3 months. Le kabu apo chuanga Hmaibawl hi adam duak ngai lo wa thlathum tal minimum chona du thina. Inflammatory lesions improve rapidly but comedons take longer. He po hi experience atang pon kan soi thina. Inflammatory lesions kan disu nai la lian hui hi adam ma zo ka amaro chu I achu hol phum thuk teu de hoi dam har zo ni. Effectiveness cannot be judged before 8 weeks and is best assessed at 12 weeks. Dam lo reng an no kalin thaka nu ate kan ko thin na chan chu thaka chu karli ni me ya thani nu te kan ko thin na chan chu I karli kar nu vela the kar so pani 12 weeks nu apo improvement hi adjust the chawani ti ni le ka bu apo 12 weeks is the best time to judge for effectiveness of treatment. That means if you feel that your acne medication is not working, you might be too much in a hurry. You have to wait for at least 12 weeks to find out if it actually is working. There is no magic in acne treatment. Magic omlo are do tong na omma se atai la chi kha chu are ma ro chu I kadam haru tukrunti ang chi kha inom china bu ale ka bu point ja ka I treatment hi amuanga voile ka tare do tuak tura be se no khan I kanril ro te po hadam china ni. Now G says continued retinoid application after lesions clear. G. This means that once the lesions are clear, we have to continue application of the retinoid cream so that it does not come back. It is used as a maintenance therapy. Noi reng khan arnge omzel tu kha I alo veng thina noi reng tu pon kan din shil fawa noi top le mai chin hianin arnging alo siam le thei ani chu. H says apply less frequently if daily use of retinoid cannot be tolerated. Example, every other night for skipping every third night. It tolerate lo chuan in tinan even ati rawa ati khorawa ati sena ati irritate chuan zan khat dana mo zan hi dana mo zan thum dana mo noi meyang. I says although there is negligible systemic absorption of topical retinoids, the treatment should be discontinued if pregnancy is suspected. Cases of neurological toxicity and EL malformation have been reported. So itong kan cream ka itaksa ain hi blue tanaw te zuti che thei tur chuan no te a problem zu siam thei tur chuan in rai pora abikin ni chu atamangai atam lawa report po tam law maro chu risk ka tuma in da low tour. Coming to the last topic, combined retinoid bacteriostatic therapy. This is very, very commonly used in our practice. The retinoid which we usually use is adapalene or tretinoin, combined with an antibacterial like benzoyl peroxide or clindamycin, which is usually very commonly seen as a therapy, combined therapy. And how does it work? So it works like this. Common combination hidora pole dura tama. Intinget hodan enang. The retinoid prevents or removes comedones, whereas benzoyl peroxide or clindamycin eradicates P. acnes. So that means the retinoid can also enhance absorption of the product. Irritation reaction limits the use of this combination therapy. So it means that retinoid, as I've said, the stickiness of the cells around this area is taken care of by the retinoids and comedone formation is decreased, and also allows increased penetration of the bacteriostatic drugs like benzoyl peroxide into the sebaceous gland to decrease the inflammation and decrease the activity of the P. acnes bacteria. So itong kan retinoid chuan in helaya I cell omkhom turaka hoi khum siam turaka venga chuan aven pa khan retinoid chuan vun atipana chuwang chuan in damdoi antibacterials kan ti anji kha heta thok tur khan alu thadu piktina ni chu. So for today we will stop on that. We will talk about only the treatment of mild to moderate acne using topical agents. At noi chi lampang chu kanon soidong kan ti to kha heng noi chi tren khati kanon tinanga I noi dan tur chu kan soi tong ka retinol te lang chi shim chu sana noi tur ani a abaki chu zinga mozana ponoi theve ka atlang puin doctor enkawl chuan ai nangmani Hmaibawl dana zirin ai chi te noi chi te sunscreen te mai phine te kan cho chu thina ni tin over the counter kan ti nangmani anga makeup dora te pole do tam ta kom thina khanga khan a combination a khanin for acne prone skin Hmaibawl tan siam ti anzia thina kana content kha ena poimo chu ta chuan common te kan man thin ho kha salicylic acid ti te khang te lang chia khan in side effect lo develop ta len tin nge omang ti te pokha kan soi do tang khan in claim chona she thiam ve thei do kan ringa zona kan ne chung comments ta ma kan den so don dia. As I've said, we will talk only about the creams and gels and lotions today. I will be showing a little bit of the product. If you have any queries regarding what is in the content of today's topic, you can ask us in the comment section. And as I've said, we usually when a person comes to us, depending on the type of acne, we usually don't just give oral medications. We usually combine it with face washes, creams, lotions, gels, sunblock, etc., depending on your conditions. Tuna chuanin kan product man na satlang lon kan cho na satlang lon akaron tirang thok anga choi to kang heng company kan cho thin ho hi I tu man hetia tirang tur hianin an mani tangin benefits ekma kan dong lo dia kan soi lang support tu ni kan cho tlang lon karon tilang ve shim ani hi. I want to show right now what are the common acne medications which we prescribe every day. As I've said from the book, there is clindamycin phosphate gel, which is usually prescribed as an antibiotic first line. In this we see that all these companies are having the same content, clindamycin. But nicotinamide is also there, which is a whitening agent, which is usually added for the acne marks. Heta hi chuanin antibiotic kan chothin kan ti clindamycin bi khanita a thena hianin nicotinamide atela nicotinamide chuanin enge arngeng omna nu ma dum kha khami kha ati light ve theya chumi tan chuanin kan chaw thina ni heta local taila heta benzyl peroxide kan soi kha benzyl peroxide po here gel form in oma 2.5% in hi kan kol boka kan mang thina atlang point combination in pakhat zinga pakhat lai ang tan kan pechina tin heta hian when we see this group, it's a combination. This group has adapalene and benzyl peroxide, here also adapalene benzyl peroxide, here clindamycin and adapalene. So this is basically a group of drugs where there is combination of an antibacterial agent as well as the retinoid agent. So the antibacterial agent is the benzyl peroxide and adapalene is the retinoid. So as I've mentioned, these combination drugs work really well, but whenever we prescribe this, we usually give them to be applied on pimples at night. Heng ho combination na adapalene te tel reng ho chu zana arngenga noi turing kan chaw thin tlang pui ni a chaw kop vek the hemi po hi chaw kan chaw kop thin ani a man kop thei tina ni chu ma se voi kata noi vek lovin jing le zana noi turan ten kan chaw thina heng retinoid creams kan ti po hi plain in chaw theya eta adapalene plain te po ma plain in kan affect theya so itong khan rai pora te man lo tur. These are plain retinol creams. Face wash lo entaila heta yan a content common de lek chu ain ang de vek chu salicylic acid heta oma he salicylic acid heta po salicylic acid chuan salicylic acid plain gel te po om tho ta ni he Hmaibawl noi thei pok sabon Hmaibawl ta na man chi sang hemi hi kanen chuan heta po hianin salicylic acid tel na ani hetiang hi combination face wash antinan in bualangai chuan sabon te kan chaw bik ta mai chaw bolani chuan in face wash te chaw kan manga combination kan mang thei tina ni chu